Hello, we're back this morning with Dr. Sherrill Little of South Jersey Radiology Associates to discuss some important information regarding annual mammograms.
The most common type of cancer in women is breast cancer, aside from skin cancer. And 1 in 3 cancers that women get is breast cancer. And mammograms are a way to find breast cancer at its earliest stage when the long-term prognosis is best.
And at what age should women be doing mammogram screenings and why?
It's recommended that women begin getting yearly mammograms at the age of 40. There are some guidelines out there that recommend beginning at 45 or 50, but about 15% of breast cancer is seen in women in their 40s, and the incidence of breast cancer in women in their 40s has increased in the past few years more than the incidence in older women, so it's better to start early.
And Dr. Little, can you tell us why early detection is so important?
So the earlier the cancer is found, the better the long-term prognosis is for patients. And it also often helps patients not have to go through more aggressive treatments such as chemotherapy. If cancer is found in the earliest stage and confined to the breast, the long-term survival is about 99%. When it starts spreading to regional structures such as lymph nodes, that drops to about 86%. And when cancer is spread to other parts of the body, the 5-year survival drops to about 30%. So the earlier it's found, the better off you are.
And what are some of the myths or misconceptions about breast cancer?
Some women think that they don't have much chance of getting breast cancer because there is no family history of breast cancer. And that's one of the biggest myths about breast cancer. 85% of women who get breast cancer have no family history of breast cancer. It is important to know your family history because having relatives with breast cancer can increase your risk of getting cancer, but just because you have no relatives who've had breast cancer does not mean you're in the clear.
And can you tell us a little bit about South Jersey Radiology Associates?
South Jersey Radiology has been in the area for over 80 years. We have 17 offices and 5 dedicated women's imaging centers. We have evening and weekend appointments, as well as online scheduling to try to make the process easier and more accessible for patients. We were also the first center in the area to be recognized as Breast Imaging Center of Excellence by the American College of Radiology. And that just is a way to show our dedication to providing the best care to patients that we can. We do everything from mammograms to biopsies and everything in between. There are a number of facilities in the area who only do screening and diagnostic mammograms. And if patients need additional imaging or biopsies, that leaves them scrambling to try to find another facility to get those performed. And that just causes more stress for patients in a situation that's already very stressful.
Dr. Sherrill Little of South Jersey Radiology, thanks so much for joining us.